with our webinar. Um, so yeah, I first really wanted to welcome everyone. Welcome to GB Week, and also thank you for joining us on today's webinar of what it's like to go on a brigade. I'm Gabby. I work as a marketing associate in Global Brigades, and also I'm based in Panama. And I'm just very excited to be able to be here with you guys and hear from volunteers, from past volunteers about their impact stories. So I'm very, very excited about it. And definitely what we really wanted to do first was Dr. Shito Bor just had a little bit of a video for you guys. Unfortunately, she couldn't be with us today, but she still wanted to be able to say hi and then also be able to celebrate GB Week with all of you. So I'm just gonna play this really quick and hopefully you
Hey
guys can
everyone,
hear it
it's
all
Dr.
right.
Sheetal Vora, and first and foremost, I am so excited to wish everyone a happy Global Brigades Week. Happy GB Week. So this week is about a lot of different things. Number one, it's to celebrate your initiative and your leadership as a campus chairperson, as a chapter leader, as any specific role that you play. You really make the engine behind the organization run. So this is your week to celebrate yourself and your leadership across the organization. Also, it's a way to celebrate all of the impact that we've done in our partner communities, from all the different programs that we run to all the different initiatives to really inspiring community leaders, to inspiring the younger community, hopeful leaders within the community. Every brigade, every single volunteer hour, every single minute that you're spending on the organization makes a significant impact in our communities. And that's also what we're celebrating this week at GB Week. Lastly, we want to celebrate the future of Global Brigades. We have so many goals that we've set together with you as team members, as staff members, as chapter leaders and volunteers. And we're also so excited to think about the impact that we're hoping to make in 2025. So we can really leverage this GB Week to reflect on what we want to do for the remainder of this year, but also what we will do for the remainder of this year. So I just want to say happy GB Week to all of you. We look forward to seeing all of your social media posts about GB Week. Don't forget to include the hashtag. We look forward to seeing all the great ideas and all of the different ways that you're celebrating on campus. And we look forward to having the best week ever celebrating the organization that's really near and dear to all of us. Thank you.
I also wanted to highlight, I think GB Week is a way to celebrate all the impact, just as Dr. Shita was saying. In done by in partner communities by volunteers like you, and hopefully if you have never been on a brigade before, you will be able to see a little bit more and hear from volunteers of what it's like to be doing that impact in community. And just again, like every minute that we spend on the organization, whether it is on your pre-brigade journey, which we know it's quite a lot sometimes, but also being on brigade and even on post-brigade, just telling others about your experience, like past volunteers that are here, but also sharing on social media, all of that, every single minute that you spend on the organization, on brigade, involved in your chapter does create a sustainable impact in healthcare and in economic development. So we just want to continue celebrating GB Week this year with all of you, and hopefully we can see a lot more from your chapters of what it's like to celebrate in campus. And
Hey,
then I also just wanted to, and we always kind of like go over a little bit more just in case like you are kind of new to Global Brigades. We always like to just highlight a little bit of what it is that we do. So Global Brigades, our mission is to inspire, mobilize, and collaborate with communities to achieve, just as I was mentioning, their own health and economic goals. And a lot of it comes from volunteers like you. It has been going on for over 20 years now. So it's definitely a lot of work being done by volunteers and students in college alongside of community members and staff members, so local staff as well. And we work in a couple of areas. Central America, West Africa, and Southeast Europe. So we work in Guatemala, Honduras, Belize, Panama, Ghana, and Greece. So those are the countries where usually brigades happen. And we're very excited also to be able to share a little bit of each country if anyone is interested on it. And then one of kind of like is a little bit different about Global Brigades is the holistic approach. And if you have been on Brigade, you probably have heard about this. Or even if you're kind of on that pre-Brigade journey, maybe you have heard about the holistic model already. And it's pretty much how all of the different aspects of a brigade and how the different programs work together to meet those goals that we were talking about. And at the end is to empower the communities, right? So you have sustainable health systems, but you also have economic development, and you also have water and sanitation infrastructure, which we often call WASH. So on sustainable health systems, you can find clinics, mobile clinics. You also have clinics that are running year round, like in Greece. You also have year-round programs like the community health workers. In economic development, you have community banks, you have business consultation, and then water and sanitation, which is WASH. You also have water systems, education on basic sanitation committees, and then you have those water inaugurations. And if you have not seen it or you don't really follow our social media, which you definitely should just to be a little bit more updated on what it's happening with communities. We just recently had a water system inauguration in Honduras, and it was incredible to see the celebration that it was being done with the community members, and it was like making everyone in the community very proud, but also just volunteers that were involved in there and the community members that worked very hard on that water system, as well as all the community members and the local staff that worked on it. It was like very, very nice to see. And hopefully we can show you through this week a little bit more of that water inauguration as well. Just because we're very proud of those projects being finalized and all the impact that it's being done on that specific community as well. So this is just a little bit of our holistic model and how all of those pieces work together. We always kind of like to say that if you're healthy, you can work, and if you have sanitation in your community, then you can become healthier. And it's kind of a cycle of things. So definitely that is the holistic model in a very, very, very simple way. And then I wanted to give some space to some of our past volunteers, and I will love if they can introduce themselves as they start to talk. But we have a couple of them joining us today just to talk a little bit of their experience on Brigade. So we have right here where they have been on Brigade and also a little bit of stats that I'll go over after they talk about their Brigade experience. But we have Maddie with us. So Maddie, I don't know if you want to introduce yourself and then just talk a little bit about how you got involved with Global Brigades, but also just your brigade experience in general. I don't know, Maddie. Mm. Oh, I think maybe Maddie is having some issues. And we can go back into Maddie, but we also have a couple more people joining us. Rishi, I know that you also wanted to just talk a little bit more about your experience. And just as Alexa said, if you would like to also talk a little bit about what school do you attend, what is your major, and then just run us a little bit about your brigade experience that I know will help everyone in here just hear from you guys what it's like to be on Brigade as well.
Yeah, hi. Can you guys hear me?
Yep, all good.
Hi, my name is Rishi. I'm a junior public health major at the University of Maryland, College Park, and I went to the Honduras Brigade in La Paz, Honduras, this past summer, in June. And yeah, it was easily the best experience I've had in my life. It made sure it solidified my interest in healthcare. And at the time, I was pre-PA, but after the brigade, I did a lot of thinking, a lot of reflecting, and I ended up changing my health career track to pre-med. So that's all thanks to brigades. I learned so much about everything, honestly. There was a medical aspect I was able to learn about, but also a cultural aspect, which is equally as important. On the medical side, you get to see all these providers, physicians, dentists, nutritionists, ophthalmologists, pharmacists. You see them working, and so you see them like in their natural environment, and like in a clinic. And it's great to really get that experience, and you get to understand a lot about the country's the medical necessities, like the differences between Honduran medicine and American medicine, which is really cool. But also on the cultural aspect, you get to see so many different types of people, all who have gone through different things, and it's really eye-opening, and it's amazing to see how all these people really work together to help their own community, like whether it be just the members of the community or the in-country staff, everybody's working together to help each other, to support each other, and it's beautiful to see. We did not get to do the public health day, unfortunately. That's one thing I'm excited to do on the next brigade I attend in Panama. But from what I heard, we did have a Guatemala brigade this past winter, and they were able to build a bathroom for a school, which did not have a bathroom previously. So that's really amazing, and I would love to take part in something like that. As a public health major, I believe it's really important. We have public health projects as well, and it's amazing how that works. And also another amazing thing I we took part of was the Charla station. At first, I was a little surprised that that was there. I was like, oh, okay, we're just gonna be working with kids. What are we gonna be doing? It's actually probably one of the most important ones. We have when we're educating the children, they're the young ones, they're gonna be the ones to grow up and really pass on the knowledge to their kids and their kids after that. So what we were doing was we were teaching the kids about oral health because that's a big problem. There's a lack of education and a lack of access when it comes to oral health in a lot of countries. So we're teaching them about oral health, and we gave them hygiene bags with toothbrushes, toothpaste, and they were all so appreciative and so excited to learn. And that was amazing. And you get to really connect with the kids as well. We get to play games with them, become their friends, and then you get to talk to them about brushing your teeth, just the basics. And honestly, that it was amazing overall.
Nice, nice. Thank you, Rishi. Yeah, I think it's amazing also to hear just a little bit more of the background and how you were previously maybe on a career path before your brigade and how, brigades changed that perspective for you. I think that's also a lot of people come into brigade just to experience that, right? The medical aspect of everything. But we do have a lot of volunteers that join us that are not necessarily pre-med, just like you. And then they kind of see it in a different way. But also a lot of them, and we're not saying that you have to join a brigade not being pre-med and then kind of leaving the brigade being pre-med. You definitely can still be on the public health path, and still be interested, and still you're learning a lot of it. So it's definitely very nice to see different stories coming in. I don't know if anyone has any questions for Richie. But I also want to thank you again for sharing a little bit of your brigade experience, and we cannot wait to hear your experience from your next brigade as well. Hopefully, you can explore a little bit more of the public health part as well, and we can catch up on things afterwards as well. So we're excited about that. Yeah, and then we also have Paige joining us, and just as a highlight, Paige is also a chapter leader. So we're very excited to be able to not only hear your brigade experience, but if you also, Paige, if you want to highlight anything about being a chapter leader or your experience in there, it's more than welcome as well.
Of course, thank you so much, Gabriella. Hi everyone, my name is Paige Boylan, and I'm the chapter leader for the Global Medical Reach chapter at University of Maryland. And Rishi, who just spoke, actually is also on like our executive board. So Rishi and I work super closely together. And I've been on the past brigade with Rishi as well. But yeah, so I'm a senior majoring in kinesiology, and I am applying to medical school this upcoming cycle. And Global Brigades has definitely shaped my like entire experience for like my Y medicine, and it's a huge part of my application. So I owe a lot of my knowledge and my passion for medicine to Global Brigades. And so over the past 4 years, I've been a part of Global Brigade since I was a freshman. I've been on brigades to Panama twice and going on 3 times this summer, which I'm super excited about. I've been to Honduras, Guatemala, and Greece. And then we also have another like 2 brigades planned this summer. So it's like been a long journey since we started. For a little bit of like our chapter's background, we kind of got the chapter back off the ground after the pandemic in 2021. And so my first in-person brigade back was in 2022, which was to Panama. And that's just like when I fell in love with the organization and everything that it has to offer. And I just want to share, my journey with you guys for you who may be in the same shoes right now, like unsure about what to expect or unsure about if you want to fully commit to going on a brigade. And so honestly, yeah, like first signing up, you don't really know what to expect. You just know that you're gonna sign up and go and be with these other students who have like-minded passions, like just like you. But genuinely, like I had no idea how much it was going to impact me professionally and personally. So I guess I just want to share some of my like core memories so far. But Rishi did touch on a lot of the stuff that we get to do in the clinic, that you get to experience all these different stations and learn from these local doctors in shadow and volunteer and like really feel like you're making a hands-on impact and seeing firsthand like these disparities that you're actively going there to learn about and educate the community and like talk to them about their own life experience and lived experiences. But I guess more on like a volunteer side, one core memory I have from like this past brigade I went on to Guatemala was that it was two of our volunteers' birthdays, so it was really special because we got to celebrate with them at night. So me and my other co-president, he's not here today, but Jonathan, we got to the coordinator took us to like a local bakery. We got a cake and we got to celebrate their birthdays at night and we all stayed up till midnight and like blew out candles for them. And so that was really special because it really just like tied us all together even more. Like coming back to the country, our team like is still friends like to this day. And I really like how over the years we've implemented like processes to like make everyone like tight before we leave the country. And then once we get there, our team is even stronger and like more collaborative. And coming back, like we all still see each other on campus and have classes together. And so yeah, that aspect, like you'll definitely get a pre-med or whatever pre-health community you are like pursuing, whatever path you're pursuing, like you'll have these peers like once you leave. And when you come back. So I think that's like an amazing aspect of like the team dynamic that Global Brigades does provide. Um, and like yeah, just as like a chapter leader perspective, like I just love seeing like how the volunteers like grow and like just become as passionate as I am like from day one. Like I remember my first experience and then seeing everyone just like have this eye-opening like I guess like spark and then throughout the like course of like the 7 to 9 days like everyone just becomes more and more immersed in the experience. And I also just want to touch on the Charla like Rishi was saying. I think that, we go to learn about medicine, but you honestly leave with so much more and like connections with the community staff and the patients and like in the Charlotte, the kids are so like moldable and they're so excited to meet you. And it doesn't even matter if you don't speak Spanish or the local language, like you can still connect with them on such a deep level. And I would recommend, of course, trying to learn Spanish beforehand if you don't know any. It definitely helps, and Duolingo goes a long way, and Google Translate really does help. But if you just know like key base words, like the kids will pick up on it and grasp to you and really just like take whatever you know and run with it because you can play games with them. And like I know a lot of our volunteers like playing soccer with them, and card games and things like that. And one like special moment was that I remember the kids were talking to some of our volunteers on our past Summers Brigade, and they said that they wanted to be doctors now because of us. And so it's just so inspiring how like you change these people's lives more than you know. And to just wrap up, I just want to say that one quote that a translator told me one time was that we might not change the world, but like like these people's world will change like just because of us. So we might not realize the impact that we're making like just this week being there, but they're gonna remember us like for the rest of their lives. And so we have to be super mindful and intentional when we go, because yes, like we're learning so much that we're bringing to them, but they're also teaching us so much. And it's just going to be a memory for everyone that they're never going to forget. And yeah, it's changed my life so much for the better. And I don't know where I would be without Global Gates. So if you're considering, you should definitely get involved.
Thank you, Paige. I think that's wonderful, and I'm very glad that you guys could touch on like several things. Definitely, it's nice to hear all the different aspects on Brigade. Just as you mentioned, as well as definitely that medical experience, but it's also so much more the cultural exchange, and everything. And also, that's one of the things that we always like to ask, like, what excites you the most about a medical brigade, right? Like what excites you the most about global brigades in general? And we do have a whole like, is it the medical experience of it? Is it the community impact? Is it the cultural exchange? Is it the personal development? But at the end, you do experience all of this, and we really want you guys to be able to experience all of that as well. And I wanted to ask, like, Paige, do you have a favorite station while on the clinic? And same goes for you, here as well. Like, do you guys have Risha, like any favorites like stations aside from Charla? Definitely, I catch that that is a huge one for the both of you. But any experiences maybe that you want to highlight on doing some consult or maybe like I know that for some people dental it's something that they don't expect to like a lot, but once they're there it's very very impactful and very new and an experience that maybe they've never expected to experience before. So I'm kind of wondering if you guys have any favorite stations in the clinic.
Yeah, yeah, absolutely. I think it's really hard to pick one because I really love learning from all of them because you really take away so much from each one. But first, I guess starting with consultation, I've learned so much in the consultation, which has honestly like molded my why medicine just even more. Like every brigade I've gone on, like I've learned so much from the consult, and the doctors are so willing to teach you and like guide you, even if you don't speak Spanish. There's translators, and most of the doctors are bilingual, so they'll be able to pause and like take breaks and like briefly update you on what's going on as you like watch the treatment plans being developed and just learning about the patient history. Um, and so like as I mentioned, I'm a kinesiology major, so a lot of my classes are in like the School of Public Health, and public health really interests me. And so seeing and like learning about social determinants of health and like the drivers of health in the classroom, and then going to Central America or Europe and learning about how these like determinants are actually affecting these countries directly, and seeing these patients and like seeing how they tell us about their history, and like they may present with like diabetes or hypertension or things of that sort, and you learn like this is why like these like things are coming up so often because of these disparities that they're living in that may not be in their complete control. And like watching the doctor specifically form like these treatment plans that you know takes into account all those disparities that aren't necessarily in their control, but it's just their lived experience. Like, I think that's really amazing. And taking what we learn from them and how they are able to make these treatment plans is something that I'm really inspired to bring back to like my local community and like hopefully be a doctor here in the US. Um, so yeah, consult you learn so much. And then I guess one other I do want to touch on is dental, like Gabriella said. I'm not pre-dental, but there are a lot of brigaders who come on our brigades that are pre-dental or who may not have been, and then they experience a dental station and they fall in love with it. And I would say the same has happened for me. The dentists, first of all, are so like knowledgeable, and they teach you so much. You don't have to know anything prior. They'll prep you in the morning and tell you what they need from you to prepare the tools that they might need, and they'll walk you through the steps of what they're going to show you as they treat patients. And it's definitely one of the more, I guess you could say, um, like exciting stations. Like you see a lot going on. Like there's cleanings, there's fluoride treatments, there's extractions. There's just a lot going on, and it's a very rapid, like fast-paced station. But yeah, it's really cool. You get to like gown up and put a scrub cap on and things like that, and you feel like you're really making like a hands-on, like tangible impact. And seeing people leave like happier when they, get these treatments or they get like their cavities looked at or things like that. They come in with a lot of concerns, and then and the dentist helps them feel better. And you're there throughout the treatment process, like holding their hands and like encouraging them. And it's like not fun for them because obviously they may be in pain or they may like be unsure of what's going on, but you really learn that like cultural competency and empathy to treat them and like be there alongside while the doctor's treating them, but you're there just as much as important as them, like that emotional support. So yeah, I think those two stations are honestly amazing, but every station I could say something about. But I don't know if Rishi wants to add anything about maybe one of his other favorite stations too.
Yeah, you said it. It's very hard to find like your favorite station because all of them are amazing in their own ways. Console and dental are usually the most popular. With pre-meds, pre-dent, and people. Yeah, you get a lot of experience as like a doctor, like or working with a doctor in the console, and you get a lot of experience working with dentists in the dental stations. But another really fun one is actually for me, I enjoy nutrition a lot. It was really random. But we were working a lot with the kids, the children population. So we would our nutritionist would have this electric like scale where it would measure your like body fat, protein percentages, bone densities, and she was able to see whether or not someone was malnourished, adequately nourished, or if there was other problems with them. And I thought that was really, really interesting. Actually, the picture on the top right of the slide is from the nutrition station where we're working with those two little girls. I remember that one specifically. They came in and we were like playing with them, but we were also working on the nutritional aspect. We were talking with their dad to figure out what they need for what their like diet should look like, what they should add, what they should take out, what they should eat more of, you know. And I thought that was very, very interesting and very important as well.
Nice. Thank you, Richie, and thank you, Paige. I'm just wondering, just because definitely I feel like it's a different experience for every single person that goes on Brigade. And it's a personal thing, right? Like some may definitely enjoy a lot more the educational part of it, some may like a lot more the dental part of it, and some may just enjoy it a lot being on the console, shadowing the doctors, maybe even pharmacy. I know that a lot of brigades do not expect to like pharmacy, but you're learning a lot as you go. So it's very excited to hear like different experiences and how they you kind of interact with the different stations. And I just wanted to highlight, like just as Rishi was saying, they had a nutritionist, like different brigades and different chapters may have different stations. So you definitely get to explored different specialties as well. And one of the things that I kind of wanted to just run over and cover a little bit is you see numbers from each of their brigades, or their last brigades, since they have been in a couple, in here. But this is also part of your brigade experience. You will get the kind of numbers of the people that you impacted on brigade. So you can see in here for Reach's last brigade, which was in Honduras, you can see the amount of patients that the groups like saw, and then you also have the vision and dental screenings as well in there. So you can see after your brigade in numbers the impact that you created in those communities. But we also wanted to highlight that that impact, we also want to make sure that is quality impact. So definitely being able to sit down with a community member and provide that consultation, it's very important, and not necessarily seeing them just as a numbered after your brigade as well. And you can also see page numbers for her last brigade as well in Guatemala in here. And you can see it's always going to be a little bit of your general consultations, dental treatments, the vision screenings, even the amount of health educations can be quantified as well, because we want to make sure that we can take those numbers and continue to work with community members as well. But I also just wanted to thank again Rishi and Paige for just going over a little bit of their brigade experience. And what I really wanted to just show you guys as well is that we have a video of what a brigade looks like, and I just wanted to really highlight a couple of minutes of it so you can also see a little bit more of what a brigade looks like.
Being here for a week is a true immersion that by the end of the week, you're speaking Spanish 10 times better than you were at the start. And I know we have so many people on our brigade who came in with absolutely no Spanish, no skills, and they were still able to communicate incredibly effectively with, members of the community, patients, and everything like that.
What started as passionate young adults wanting to make a difference turned into an empowering force of changemakers. We are the largest student-led movement for global health. We're collaborative, we're sustainable, and we're empowering.
For this brigade, we're having different stations, and I'm about to introduce you to each of them. So first, we're having intake, which is in charge of some people from the community, and we take the patient's ID number. After that, they walk with a runner to triage, in which we take their vitals, BP. After that, they get to the consultation. So depending on the symptoms and everything, they talk to the doctors. They will get referred to either PT, nutrition, or get a rapid test. And after that, they will go to Charla, and then finally, pharmacy to pick up their prescription by the doctor.
So when you come to Ghana, the last station that we have is the home visit. Home visit is designed in a way that our students go out to advertise the clinic that we are having.
And it was a great way to still get them the care that they deserve, but they weren't able to come into our clinic. So being able to go do their intake, have the doctors come to them, and then come back with their prescriptions at the end of the day or the next day was really something special, and I liked being able to be in the community actually making a difference.
So that's just a kind of a very, very quick sneak peek of what being in a brigade is like, and just definitely seeing a little bit of the brigade experience. And just as we kind of been mentioning, different countries definitely have a little bit of a difference, but it's always going to be just creating that impact in healthcare, at least for medical brigades with community members. So I also wanted to ask if anyone here is going on brigade soon, like which country are you brigading in next? Just to see where everyone is standing. And maybe if you have not joined a brigade yet, you can also just put that in there, and hopefully we can help you join a brigade as well. But we're very excited to continue hearing from volunteers what their brigade experience is all like, and it does help quite a lot to show others and future volunteers of what to expect under brigade. And I know that everyone just appreciates a lot to be able to see what they will be doing as well. So one of the last things that I wanted to mention was why join in, and I see quite a few people are joining Panama, Greece. Maybe a couple of you have not joined a brigade yet, so this is your opportunity to also learn a little bit more of brigades in general. But we always like to highlight this couple of things, right? Impact, belong, grow, and also have fun. So you have here just a couple of why it's different and why you should join a brigade. And you can see in here, definitely impact is something that you will create while you are on a brigade, but also you'll be able to join students that are kind of in the same path as you and create impact together. And I think Paige mentioned this, right? Like being able to kind of get together and then just kind of create that link between everyone before joining the brigade, but also making friends while you are on brigade. It's definitely something that you will find along the way. And you'll definitely grow. And I think one of the things that we had on the poll and the first poll was having that personal development, right? And having that medical experience or consult experience. If it's a business brigade, you will be able to gain value from local physicians and local staff, while also building definitely a global perspective of things, and having a little bit of perspective on the challenges that communities members do face a lot. And then just again, kind of having that aspect of fun, having that experience with others, making lifelong friends, being able to interact with community members, with local staff is always a very nice part. Even if it's your birthday, you'll be able to celebrate on brigade as well. So definitely you'll be able to have a little bit of the different things that you see here on the screen. But yeah, I definitely want to open the floor if anyone has any questions for either Paige or Rishi or even us as staff members. We're more than welcome to answer any questions that you may have. But we also just wanted to again thank you guys for being able to share your brigade experiences. And hopefully we can continue to keep you updated on how your next brigades will be like as well. But yeah, if anyone has any questions, you're more than welcome to put them on the chat box as well, or just unmute yourselves. And yeah, I can share this. So Paige, they had a brigade, a little bit of what it means for them to be on a brigade, or what GB means. So we can play a little bit of it, just because I remember this being a nice, very nice, very nice video. So I can show us a little bit of a snippet on it. And if anyone has any questions, we can put them on the chat box and we can go over them after the video as well.
Global Brigades is an international nonprofit organization that uses a holistic model to support community health and economic goals.
Desde el 2003, estudiantes voluntarios de más de 500 secciones universitarias en todo el mundo han empoderado millones de personas tanto en Centroamérica como en África Occidental y Europa.
Global Brigade's core values that drive our service are empowerment, a holistic approach, scalability, sustainability, financial transparency, and collaboration.
Medical Brigades host clinics in Panama, Guatemala, Honduras, Greece, Ghana, and Belize to support preventative and primary health care in underserved communities.
Las brigadas médicas ofrecen a los estudiantes de ciencias de la salud la oportunidad de adquirir una experiencia en el contexto clínico mientras tienen un impacto concreto en la salud global. During the 1790 Brigade, student volunteers shadow local doctors, support medicine distribution, and help lead health education workshops called charlas.
Community members are provided with pro bono general medical consultations, pap smears, vision screenings, dental fillings, cleanings, extractions, and other specialized care based on the scope of our healthcare professionals.
Quizás te preguntes por qué el programa de Global Brigades es diferente a otros.
Number one, Global Brigades is funded through student movement, which gives us the autonomy to develop programs that are specific to the needs of each community, rather than on the whim of a few large donors.
Number two, Global Brigades projects include community involvement for the empowerment of local leaders and future sustainability.
Number three, Global Brigades employs more than 100 full-time local staff members.
Number four, Global Brigades works with the local government to gain support in funding and transportation efforts.
So really, what are you waiting for? Join Global Brigades.
Don't you want to make a change in the world too? Join Global Brigades.
Join Global Brigades. 1, 2, 3.
We love Global Brigades!
So yeah, it's always wonderful, just as I mentioned, to be able to see from volunteers what it's like to be on Brigade, and hopefully, just as I said, we can continue to see you guys and your chapters as well, future experiences and the future brigades and all the impact that you have created. And I just want to thank everyone again for joining, and you will receive a recording afterwards. So even if any of the videos were a little bit choppy, or if you want to revisit any of those, we'll be able to send them to you afterwards, and you can just revisit a little bit of the experience, and hopefully you can maybe share your experience the next time that we do a webinar, and that we continue to celebrate GB Week next year. You can share your experience by then. But I wanted to thank everyone, and hopefully we can continue to celebrate GB Week with all of you. Thank you everyone for joining. Have a good rest of your day.
Thank you, Gabriella.
Thank you, Paige. Thank you, Ricky, for joining.
Thank you.
Have a good one, guys.